Hi guys, welcome back to my channel. So I had a whole bunch of videos set up to go for the next few weeks, but in light of everything that is going on around the world now with the COVID-19 pandemic, I've decided to postpone all of them and do a number of videos on this, just because I think it's really important and we need to address it, and we need to get as much information as we can. So basically today's video, it will be just that. It will address exactly COVID-19, coronavirus, and now it's going to be a peel of all the information that I could find on this. It's all coming from official sources like the World Health Organization, the Center for Disease Control. I'm going to put their links in the description box below also. So if you want to find out more information and keep up to date with everything that is going to come up in the next few days and weeks and months, go and check out their websites. They have really nice information there. I just took out some essential things that I think everybody needs to know. So that's what I'm going to give you today. Before I give you the information that I have, I just want to mention before that this is a global thing. Nobody is immune. We don't need to panic, but at the same time we need to take it seriously, and we need to take it as adults responsibly. If your government, your officials are coming up on TV and are saying you need to do this, you need to self-isolate, you need to work from home, you need to stop going to events or stop meeting people, whatever they're saying to you, you need to take it as a responsible adult that lives in a society where you need to follow rules, because that's why we live in a society. If you don't want to follow rules, go and live in a forest with the animals. If you want to live in a society with the rest of the people, then you need to follow the rules that that society imposes to you, because that's the reason we are where we are now today. People decided not to follow the rules that were imposed by the government where they live, and they decided to not self-isolate. They decided to travel. They decided to go and meet people and kiss people and hug people and whatever. If they're coming up on TV, their job is to keep us safe. That's why they're paid. That's their job. If they're coming up each day or each week and telling you to self-isolate, to do this, to do that, you need to be responsible for your life, for your close one's life, and for the life of the people that you live in the same society with, in the same country with, and take measures as you are told to take measures. So that was me telling you off, because I know there's a lot of people who just go, it's nothing, it's just the flu, it's nothing, it's fine. I'm going to give you the information now, and you're going to find out that it's not actually just the flu. Okay, so I'm going to apologize in advance because I have my notes here, because I went on the websites that I mentioned and I took the information that I think everybody needs to know. So I'm just going to look at my notes from time to time because I don't want to miss anything. So first of all, what is it? So COVID-19, is a disease that affects the lungs and the airways. Coronavirus is the virus that causes the disease. Coronavirus is not a new virus. It's a virus that's been around for a while now. It's the same name of the virus, which is coronavirus, was the one that was responsible for SARS in 2003. So it's not a new virus, because I know some people might think that it's a new virus and how did they know that is going? So I did a bit of research. It's not a new virus. It's a virus that has been around from actually 1960 is the first registered case where they discovered coronavirus. the difference between those coronaviruses and the one that we're dealing with today is that this is a new strain of that virus. So it's a basically new configuration, if you will, of that virus. Okay, the danger that this virus poses is that we never had it before. So our immune systems are a bit, well, I don't know what to do with this because I never come across this thing. So I don't know. We don't have any antibodies for it. And also, from the information that I found, apparently our immune system is a bit like, oh, bro, you look nice, let me help you. So it's kind of not even fighting it because it thinks that it might need a bit of help to do some more damage in our body. So that's why it's a big risk for our health. That's why it's a big risk for the health of the people who have pre-existing conditions like lung diseases. It also affects blood streams and the heart, but not as much as the lung and the airways. Second, symptoms. Reported illnesses range from mild symptoms, to severe symptoms and also death, as we know. Most people who become infected, most of the registered cases of people who become infected, they reported mild symptoms. So this is the reason we shouldn't panic, because if, touch wood, let's say you have it, you come in contact with somebody who has it and you get it, if you don't have a weakened immune system for any reason, or if you don't have a pre-existing condition like a lung problem or heart problem, you might actually be just fine. You might actually only have one of the symptoms, not the whole range, and you might actually not even feel like you're having it. In saying this, the following symptoms may appear 2 to 14 days of exposure. So that's what they're saying. If you come in contact with somebody who has the disease, you need to self-isolate for 14 days, because it might take 14 days for the blooming thing to actually show anything. So the symptoms are fever, cough, and shortness of breath. Again, in saying this, people might only have one of them. They might only have a bit of fever. They might only have a bit of new cough. But you might actually have all of them, and you might actually have worse than this, because you might actually have some other problems that will get you to the point where you can't breathe. Well, if you get to that point where you think you can't breathe, you can't catch your breath, you have a severe cough, you have a very high fever, don't hesitate to call the ambulance or the number or the emergency healthcare that you have in your country. I live in UK at the moment. For us is 111. So if you have one of the symptoms or all the symptoms and you feel like your life is in danger, you feel like at this point I would actually need to see a doctor, please dial 111. Don't go to the GP, dial 111 and they will tell you what you need to do. Okay, so how does it spread? So as I said, COVID-19 is a new disease. Not we, because I'm not one of them. The scientists are still gathering information about this disease. So at the moment, although there's a huge amount of registered cases all over the globe, there's actually not enough registered cases. I know it might be silly. I know you might think, well, there's a huge amount, how can it not be enough? For the scientists to actually say for sure, this is what happens with the disease, this is the period, the incubation period, this are for sure all the symptoms, this is for sure how the disease spreads. There are not enough registered cases for them to actually draw conclusions exactly. They are drawing conclusions based on the number of cases that we have at the moment, and they're still gathering information. So the way it spreads, mainly from the information that they have now, is that it spreads from person to person, which means that if you come into contact with somebody who has the disease and has symptoms, you are most likely to get it. What do I mean by coming into contact? If you are close to 3 feet, which is 1 meter, from a person who has the disease or has the symptoms, then again you are most likely to get it. So social distancing is important for that reason, because if you are closer than 3 feet, 3 feet or less actually, then you are likely to get it. Another way to get it is by throat respiratory droplets produced by coughing or sneezing. So when any of us sneezes or coughs, they're like little droplets that go all over the place, and those will have the virus if you actually are a person who has the virus. Okay, in saying this, people are thought to be most contagious when they are most symptomatic. So basically when they are most sick. Another way of spreading the disease, so another way of contacting the disease is by touching surfaces or objects that have the disease on them. So you can touch something, let's say a desk or a light switch or something that has the disease, that has the virus on it, but if you go wash your hands with soap and water for 20 seconds, or if you disinfect them, then you'll be fine and you don't touch your face. So the main thing here is not touching your face, not touching your nose, your mouth, or your eyes. And now we're getting into how we protect ourselves, how we protect the ones that we care about, and how we protect everybody around us. So first thing that I'm sure you already heard, I'm sure you might be sick of hearing, but it's really important, is to clean your hands. Clean your hands, so wash your hands with soap and water for at least 20 seconds, and make sure you wash them properly. So not only just this side, wash this side also, wash between the fingers. There's a lot of videos out there on how you're supposed to wash your hands properly. If you can't wash your hands for any reason, because you don't have sink, water, soap, whatever next to you, you can use alcohol to disinfect your hands. The key ingredient is here that the alcohol is at least 60%, that alcohol is at least 60%. So I repeat, at least 60%. Because if you use anything that is less than 60%, that will be absolutely inefficient against this virus. Another way of protecting ourselves is to avoid touching our face, mainly our nose, our eyes, and our mouth. Just don't touch your face at all. Social distancing, is another way. So maintain a distance of 3 feet or 1 meter between any person that you come into contact with. Because as I said, this is the appropriate distance to not catch the disease. Another way is to make sure that we practice, all of us, you, the people you love, everybody, make sure that you practice a proper respiratory hygiene. So what I mean by this is, when you feel like you're going to sneeze, when you feel like you're going to cough, don't just blur out with your mouth open. That's not sanitary, and it's not common sense to do, and especially now in these times is very, very bad. So if you feel like you're going to sneeze or cough, don't use your hands. Don't just blur it out. You have two options. Use a tissue, get a tissue, sneeze in the tissue, cough in the tissue, throw it away, or use the back of your hand, like this. So chew, sneeze in it, Wash the clothes as often as you can, especially if you do this, because you might have it on the clothes. Think that if you protect yourself, you will protect the ones that you love. You need to protect the ones around you, because again, this is how we got to the situation that we are now. People didn't do what they were supposed to do from the beginning. Another way to do that is to stay at home, people. If you have any of the symptoms that I mentioned at the beginning, and I'm going to mention again, fever, a new cough, or problems breathing, difficulties breathing, self-isolate immediately. Don't come into contact with anybody, because you're going to put everybody in danger by doing so, and that's just irresponsible. Another way to protect ourselves and our loved ones is to clean and disinfect the surfaces. Here I need to make a difference between cleaning and disinfecting, because they're not synonymous, so they're not the same thing. Cleaning is cleaning, disinfecting is disinfecting. So we clean because we have a surface that has dust on it or that has crumbs on it. Then we disinfect. We disinfect with alcohol, at least 60% alcohol, and we disinfect with chlorine. We don't disinfect to clean, and we don't clean to disinfect. If you want me to do a video on how to clean and disinfect, leave me comments and I'll do that for you. I'm more than happy to do that. And I'll show you how you properly clean and disinfect the surface. And the last thing is the masks. This is the subject. World Health Organization and Center for Disease Control recommends that you use a mask only if you have the disease, or if you are taking care of somebody who has the disease. So if you choose to wear a mask because you're a healthcare professional and you have to, that's fine. If you're just a regular Joe and you choose to wear a mask, you would only do that because you have the disease or because you are caring for somebody who has the disease. If you choose to wear a mask, if for any other reason than these two reasons, then please go on the website for World Health Organization. They will show you there how to use a mask, how to put it on, because it's not as easy as putting the mask on. You have to follow certain rules, and I'm just going to give you some examples. If you don't put the mask properly, there's no point to use it. If you're going to perspire in the mask and the mask is going to get wet, there's no point in using it. If you're going to touch your mask with your hands, again, there's no point in using it. So if you choose to wear the mask, then please wear it in a way that it will help you, because otherwise you're just going to actually do more harm than good. So that's about all on the disease and how we can protect ourselves. I'm just going to go a few myths that I got from the World Health Organization side. They have more. I just selected a few that I actually heard people talking about it, and actually heard people saying that they think that's correct. So I just want to mention them here. So the first one is COVID-19 virus can't be transmitted in areas with hot and humid climates. That's false. So World Health Organizations are saying that from the evidence that they gathered so far, COVID-19 virus can be transmitted in capital letters all areas. Taking a hot bath prevents coronavirus disease. That's false also. So if you touch wood, came into contact with somebody, or touch surface, touch your face and got it for any reason, taking a hot bath will not prevent you from getting the disease. Actually, you might get burned because you might damage your skin with the hot water. New coronavirus affects old people and young people are not susceptible. That's false also. So what the scientists are saying so far, everybody can get the disease. Everybody is in danger of getting the disease. The difference between a young person and an old person is that, and the reason why they're saying protect your elderly all the elderly should stay at home, should isolate as much as possible, is because most of them have another pre-existing condition that puts them at risk. Their immune system is not as strong as a young person immune system. That puts them at risk. But as far as contacting the disease, nobody's immune. Antibiotics are effective in preventing and treating new coronavirus. That's false. Because no antibiotic will work against virus. Antibiotics are only efficient against bacteria. Also, there's no medicine that you can take to help alleviate the disease where you have it, or actually help you not get the disease, because I heard people taking paracetamol preventively to not get the disease. That won't help at all. It would actually do you more damage, because you might actually damage your liver. That is really important in our whole system. So if you want to strengthen your immune system, what is recommended by the scientists and all the people who know what they're talking about is to just do the things that you should do normally, which is eat healthy, don't eat processed foods, try to eat vitamin C from normal sources, drink as much water as you can, so over 2 liters of water, and get good quality sleep. And that's about all from me. I hope that all this information that I throw at you will help you. Another thing that I want to say to you is, please don't panic, please don't stress about it, because stress is a very important factor in getting any disease. Stress will kill you. So try to stay safe, try to stay at home if you can, try to protect your loved ones. Listen to what your government is saying you to do. So if they're saying stay at home and work from home if you can, and don't go running around the streets, don't go into restaurants and pubs and all that, do that, because they're saying that to you for a reason. And just stay safe. I hope that you all be alright. Take care of yourself, take care of your loved ones, and don't forget to love life and love yourself. Bye.